Wednesday marks the first anniversary of the day that President Obama signed the bill into law that really, and in the opinion of most Americans, is the greatest involvement in our nation's health care system in history. What we see as that law is discussed, as it's challenged in court, is a bill that was signed into law that was full of problems when it was signed into law. It was a bill full of constitutional questions, and in fact, while some courts have said it may be constitutional, others have said it's not. It was a bill where when the courts say, well, the federal government can't make you buy a commercially available product, then the same people that were saying a year ago that this requirement is not a tax are saying, well, maybe it's a tax. Maybe the Constitution allows us to define that particular purpose as a tax on the American people. But Madam President, a year ago they were saying this is not a tax at all. This is definitely not a tax. There's no way this could ever be interpreted as a tax. But when courts say that you can't do this the way this bill did it, then suddenly they try to reinvent what the law was designed to do. One of the reasons this bill has so many of these kinds of problems is it was a rush to get a bill into law, more government control of health care into law, that couldn't have passed the Senate the day the president signed it into law. And so a bill that was full of concerns, a bill that the Senate voted on, never believing that it would actually become law, but would create a vehicle to become law, became the only option that the House leaders thought was available to them, and they passed it. And they passed it without the kind of process that would have produced a law that could stand to a constitutional challenge, produced a law that Americans would be more responsive to. And while the law was misguided, I believe, in its concept, more importantly, it was put together in what I think will be seen as the worst possible way. A rush to judgment to get a law on the books, and now the people who voted for the law are saying things like, well, there may be a better way than an individual requirement that everybody buy a specified, defined insurance policy. Now, not all the people are saying that, Madam President, but some are. And they're saying maybe we ought to look for that better way. The time to have looked for that better way was before the law was signed, the bill was signed into law, not after it's signed into law. And even the White House is saying there's certainly, let's work together to change this. This is headed fundamentally so much in the wrong direction. Changing it would not be the best option. Now, already in the Senate, we've voted not to vote on a repeal of this law that would allow us to replace it with better things. And unless those votes change, I guess that won't happen this year. But the view that Americans have of this law is not likely to change either. I certainly don't believe the government has the authority in the Constitution to penalize people for not buying a commercially available product. And then sometimes people say, well, the states require that under their Constitution to buy auto insurance if you drive a car. Well, one, that's a state decision, and two, they don't require you to drive a car. You don't have to have that particular product if you don't make that decision. This gives you no options but to pay a penalty or to do what the government says you have to do. During the debate surrounding this and immediately following the enactment of the bill, the American people began to tell us that this was not the approach they wanted. In Missouri, where I'm from, the first place that had an issue on the ballot where voters could speak about whether they wanted to be part of this new concept of more government control of health care or not, 71% of them said they didn't want to be part of it. That was in a primary election. Hundreds of thousands of people voted, and 71% of them said, we don't want to go in this direction. When you look at the greater concept of what this law will do if it's ever implemented, to change the relationship of people and their government, I can't think of anything besides the government taking over the economy that actually has greater potential to change that relationship than the government having more control of your health care. What more controlling element could the government look to than your health care and your family's health care to make you sure that you never got on the wrong side of that government? It does change that relationship. It also creates real uncertainty in what should be the #1 goal in America today, private sector job creation. If a year ago the president would have signed bills into law that encourage private sector job creation or created more certainty about our health care costs, about our utility bills, about our taxes, about regulation, rather than signing this bill into law, I believe we'd be much further down the road towards seeing private sector jobs, jobs that create taxpayers that help government provide the services that only government can provide. We'd be much further down. The very clear message that I heard and others heard all over the country in the last year was we don't want to create these jobs with all of these issues out there not yet really decided, and if they are decided, likely to be decided in a way that makes that job creating decision, less of a good decision than it would have been otherwise. You know, cap and trade in the middle of the country in Missouri, the 6th most dependent state on coal for its utilities, the estimate would double the utility bill in a dozen years. What's the job creation message there? We're exactly where we were 2 years ago on the tax question, because just a few months ago the president signed a bill that extended current tax policies, but only for 2 years. So we're no further down the road on that question than we were 2 years ago today. The president calls for regulations that make sense, and I join him in that, but we see none of that coming from the regulating authorities right now. The clear message that people had was that they'd like the government to create more certainty in the areas the government controls so that they can decide whether they want to take the certain risk that you always have when you create a job. I was in Northwest Missouri not too long after this bill was signed into law a year ago, and very well remember a conversation I had with someone whose business was going well. In fact, he said, I've got 47 employees, and you'll remember that the bill creates a threshold of 50, that you have different kinds of obligation and regulation once you get to over 50 employees than you have before that. And he said, I've got 47 employees. I need to hire 6 more people right now. But I've looked at this health care law. My accountants have looked at this health care law. We're not going to get 1 inch closer, 1 employee closer to 50 than we are right now. And so there are 6 jobs that didn't get created. And his view of what to do about those, about his current situation was, I'm going to pay overtime, he said, until I can figure out what I'm doing that's not making much money, or in fact maybe even losing a little money, and I'm going to quit doing that. I'm going to be sure we get back to where we're truly a 47 employee business again, instead of what should be a 53 employee business. Or the many employers I talked to said, we're just not going to hire full-time employees. We think we can get our job done with more part-time employees who don't force us into the environment under this law, where the government comes in and says you have to pay a penalty, or you have to offer an unknown insurance policy that will be created by some group created by the Congress that says what everybody's insurance policy has to look like. You know, one size fits all almost never fits anybody, and it won't fit anybody in this insurance plan that this bill anticipates and mandates. Being sure that families still make family decisions about health care, instead of being only one option that your health care plan that is defined by the government will pay for. encouraging coverage available in other states, buying this product across state lines. There's no reason not to have a health care marketplace. And it doesn't just have to be buying the product in the half dozen states that touch Missouri, the 6 or 7 states that touch Missouri. It has to be buying in a marketplace. There's no reason it can't be buying in a marketplace that's the national marketplace. A competition produces better choices, and it also produces more choices. And more choices so that you can look at the health care plan that's right for your family or you as an individual, rather than the health care plan that some newly created board and agency said had to be the health care plan for everyone to meet the new federal government standards. Tax equity: if you buy health care on your own, you should do that with pre-tax dollars, just like the biggest corporation in America buys health care for their employees with pre-tax dollars. More transparency of how health care works. I'd like to know if I'm on the way to get a health care procedure. I'd like to know before I left to do that, what do people charge and what are their results? Most trips for health care are not to the emergency room. They're planned trips to health care. And once you're in the car, if it means driving another 20 minutes or an hour and 20 minutes to get to the place that does a better job for less money, I think most Americans would do that. And we know this, Madam President. These factors are generally known. I remember a study just a year or so ago that was checking to see the survival rates for in-hospital heart attacks based on the response time. And that information's all available. At this point, it's available anonymously, but if it's available anonymously, it would also be available specifically, and more transparency in the system. How do you go to the place that gets the best results, or if the results are the same, how do you go to the place that gets the best results for the better cost? When employers are telling us they're not hiring because of the uncertainty created by this law, when courts are ruling the law is unconstitutional, or even when courts disagree on this topic, when some courts think it's unconstitutional and some think it is, when voters are overwhelmingly rejecting it every opportunity they've had at the polling place to vote on it, something is wrong with the direction we're headed. Americans deserve a country where the people are still in the driver's seat, where the people are bigger than the government, where the people are making decisions for themselves and their family about lots of things, but particularly about health care. I'm working and will keep working to repeal this bill and replace it with things that make more sense, things that move us toward more competition, more transparency, and better health care. The anniversary of this signing next week would be better spent if we were all here next week trying to come up with things that make health care sense, that make economic sense, that meet the constitutional standard, and still keep people in charge of these important life-sustaining, health-sustaining decisions.